Hello and welcome to Sophy Ridge on Sunday. Well, by February, many of our New Year's resolutions have already fallen by the wayside, at least if you're anything like me. But Boris Johnson seems determined to stick to one of his, to under-promise and over-deliver, after spending much of last year being criticised for doing the exact opposite. Well, the UK's vaccine rollout continues to go well, but the government is staying cautious. They only confirmed this week that their target is to vaccinate all over 50s by May, after it was accidentally included in a press release. But maybe the caution makes sense. There's still lots that could change or go wrong. A raft of second doses are due in the coming weeks, and of course there's always the risk of those new variants. So a good week to be talking to the Vaccines Minister. Nadhim Zahawi will be on the show later to discuss lots of those things with him in a moment. We'll also be talking to the World Health Organisation's Special Envoy on COVID-19, Dr David Nabarro. He'll be joining us too. And we'll be speaking to Andy Burnham, the Mayor of Greater Manchester, about when and how lockdown should be eased. Tensions in Northern Ireland remain high after the EU's aborted attempt to stop exports from Ireland. We'll be hearing from the leader of Sinn Fein, McDonald. Plus, I've taken a look this week into why take-up of the vaccine is lower among certain communities and what it might mean. First, though, the UK continues to race ahead with its vaccine rollout. We've ordered over 400 million doses and we're getting them into people's arms much quicker than many other countries too. But the future here still relies, of course, on what happens elsewhere in the world. So let's speak now to our first guest, the WHO's Special Envoy on COVID-19, Dr David Nabarro. Thank you very much for being on the programme this morning.
Good morning.
How concerned are you about vaccine nationalism?
Well, the situation is that we have some excellent vaccines that can stop people from dying. These vaccines can prevent health services from being overloaded, and they are a fantastic invention. The world should be accessing these vaccines in an equal way because right now, health workers everywhere are at risk. Older people also are at risk. And the only way to deal with a global pandemic is to get fair shares across the world now. That's the right thing to do. And I'm really hopeful that world leaders in the coming weeks will realise that to have a few countries vaccinating a lot of people and then poorer countries having very limited vaccines is not really the way to go ahead, economically, socially, environmentally, and indeed morally.
You're talking about countries getting their fair share of vaccines now.
Yes.
Of course, many countries have got no vaccines. They haven't vaccinated anyone so far. The UK, by contrast, has got 400 million doses on order. Yeah. Is that something to be proud of, or is that actually quite selfish?
Well, it's totally understandable. Nobody in the World Health Organization wants to say that people should not be vaccinated if there is sufficient available. It's just that at the moment we're in a world that has quite a shortage of vaccines compared with need, and it will stay like that for some months. We've also established a scheme that enables all countries to share in the vaccines that are available. They've asked us to set it up. It's been set up. It's called COVAX. Over the next 6 months, I'm hopeful that all world leaders will commit to a fair sharing arrangement after we've gone through the present period of competition to get as many people as vaccinated as possible. In the end, it's one virus affecting the whole world. We're all at risk. We need to deal with it as a single issue.
I think, if you say things like, everyone deserves a fair share, no one would really disagree with that. I'm interested in what it actually means in practice. So at what point do you think the UK should look to potentially sharing out vaccines with other countries, and who should we prioritise?
The priority for vaccines at the moment everywhere is people who are most at risk of getting severely ill or dying from this disease. Those are people who are susceptible because of their age or because they've got other conditions. They're people who are highly exposed, for example, because they work in healthcare. That's the same situation everywhere. And we need a global policy to do that, which is perfectly feasible. What matters is at the moment that politicians believe that their primary duty is to make sure that they get vaccines to perhaps everybody in their countries. We think that citizens can actually perhaps talk to their politicians and say, hang on a bit, we're actually part of the world, and we think the first priority is to make sure that everybody everywhere gets what they need. We set up a scheme, as I said, called COVAX. 100 countries are ready to receive vaccines. They've gone through preparatory processes. We've got money to be able to buy vaccines for them. We're actually authorising the vaccines as quickly as we can. It's a longer process for the WHO than for national governments. And we just love it.
Just to jump in, I'm quite keen to clarify, you're talking about the priority to vaccinate the vulnerable, but then potentially to look elsewhere. Does that mean then that do you think that once the UK has, for example, vaccinated those most at risk, people over 50, then that's when we should start giving vaccines to other countries?
I think we should. Of course, each Prime Minister, each group of MPs has to form their own decisions. But it's really a question of what makes sense economically, what makes sense for society, and how we all want to be remembered in 10 or 20 years' time. Do we want to be remembered as a world where those who had the cash could afford to vaccinate their whole populations, and countries that didn't have the cash had to cope with a possibly quite dramatically increasing death rate among their health workers? I don't think so. I don't think that's how any individual really wants to be seen when they look at themselves over the years. And it's going to be time, I think, for a national and perhaps even global debate about what the priorities should be, because in the end, we are human, and humans need to be able to work with each other, whatever their race, whatever their ethnicity, whatever their wealth.
Talking about the global response to COVID, the fact that no one's safe until everyone is safe, the economic damage you talk about, is it sensible to limit travel at the minute, particularly, of course, given the new variants? And if that happens, do we need to take a blanket approach rather than just having certain countries on a red list?
I think the main thing about dealing with COVID right now is what we do inside our communities and inside our countries. There are two things that really matter. The first is to do everything we possibly can to avoid getting the virus and spreading it. And we know what we have to do: be 2 meters away from each other, wear masks, isolate when we're sick, and of course, practice very good hygiene. And now we've got the extra advantage of vaccines, which will save lives and also protect health services. But we also need really strong community level, locally led public health services, what in Britain is called test, trace, treat and isolate. But that needs to be really well working, because you can't deal with this pandemic without being able to stop spread. And then once those are in place, we will continue to see the numbers going down. Last point from me.
Do you think the UK's test and trace programme is working at the minute?
Well, I think it needs to do better. I think all countries need to get their test, trace, treat, isolate programs working really well with strong local support. You see, you can't do this kind of work of contact tracing and transmission interruption if you just do it centrally. You've got to get locally with central support. Last point on this one is I just want to say how brilliantly people are doing throughout the world at the moment on this pandemic. Look at how numbers are coming down in different parts of Europe, in the US right now. They're coming down because of people's actions, because of the actions of health personnel. And I think we just have to sometimes stop for a bit and say, we are doing amazingly. We've got to go on. We can't stop. We've got vaccines to help us. But in the end, it's our self-discipline that's going to get this pandemic well contained.
It is quite incredible, really, when you think about it. The sort of restrictions that we've all been living under for the last year or so, amazing. No one would have imagined it just a short time ago. Absolutely extraordinary.
Amazing.
I'm keen to talk a bit about the vaccines as well. There's a report in the Financial Times this morning about a study of 2,000 people, which seems to suggest the Oxford AstraZeneca vaccine is less effective against the South African variant. It has limited efficacy in protecting against mild and moderate disease, although important to note that nobody seemed to get severely ill or died. Have you seen the study? And are you concerned by it?
Well, I saw the press cutting that you're referring to. And yes, this virus, like every other virus, will vary. A bit like you and me, we look different. And we and other people look different, so we have variations. And some of those variations are going to be more viable than others. So, yes, we're going to see variations emerge that are particularly dangerous from time to time. We know how to deal with this kind of problem. The first thing is that we use the same precautions as we're using more generally with regard to distancing and face masking and so on. Secondly, we can adapt vaccines. The scientists are good at doing that, and we will do it. Just like we do for flu, we'll do the same for coronavirus. So yes, variations are worrying and we have to be very conscious of them, but we know they're going to come and they're going to go on coming, and we know that the vaccines will continue to have to be modified, and that's as it will be. The really important thing is that leaders all over the world need to give support to outfits like the World Health Organization, which is the only kind of organization that can keep a track on variants as they emerge in different places and can help with advice on things like travel. Each country will have to work out its own travel rules. That has to be based on their understanding of the danger. But in the end, it's what we do inside our countries that will determine whether or not we can keep this virus contained and under control.
The UK took a bit of a risk, didn't it, in delaying the dose between two vaccines against the advice of the WHO. According to the Joint Committee of Vaccination and Immunisation, the data so far shows actually quite high levels of protection after the first dose, undoubtedly saving lives, they think. Has the UK's approach been vindicated?
Well, certainly what's happening with this virus is we're learning all the time. The World Health Organization's advice on intervals between vaccine doses was based on what the manufacturer did in doing what we call phase 3 trials of the vaccine. And then WHO and its committees really has to work on the basis of what manufacturers have told them. But isn't it wonderful that it has turned out, as a result of the UK's bravery, frankly, that this extended interval seems to be associated with even greater protection? That's how we're doing COVID at the moment. We're all learning together. Different countries are approaching it in different ways. And within WHO, talking with experts from the UK, we're really, I think, benefiting from the willingness of UK scientists and UK leaders to tell us very precisely what they're doing differently and why they're doing differently. And then we add it all up and we learn from it. So, yes, I think the UK's approach, so far at least, has been vindicated. And yes, I think this is a great lesson for the rest of the world. Thank you. Thank you, British scientists.
Yeah, incredible what the scientists have been doing, absolutely. Do you think the WHO could actually change its advice then on the spacing of the jabs?
Well, that depends not so much on WHO Secretariat, the people who work in the headquarters and in the regional offices. It depends on the committee of experts, some of them British, that advise the WHO. That committee is meeting pretty often at the moment because there's lots of vaccines coming on stream, and the committee has to look at the vaccines, and it will indeed look again at the dose issue as a result of the British experience. That's great. And there's more going to come through about these vaccines over the coming weeks and months. And we, as I say, will benefit hugely from what different countries are doing. We've never had this speed of advancement, sort of doing and learning at the same time in my professional life in anything like this way.
Yeah, it's been quite awe-inspiring, really, the speed of it all. The WHO is carrying out an investigation into how COVID started in China, visiting sites, the wet market, for example, the Wuhan Institute of Virology. Has the WHO received full cooperation from the Chinese?
The situation, as I'm being told, is that the cooperation has been exemplary. The visit was carefully planned. All the sites that WHO people wanted to visit are being visited. There is openness for all kinds of communications to take place, and the work is going ahead, I think, pretty well. But it's early days. This is detective work, and those of you viewers who study how detectives work will understand that you're looking at lots of different leads and you're trying to pull together different bundles of evidence. We're anticipating that this will take quite a lot longer. I've been involved in studies of earlier jumps of viruses from animals or birds to humans. It's never clean and easy. There's never a little signpost saying, follow this path. You have to really work it out. And so what I'm going to say is great cooperation and good results so far, but it may take quite a lot longer to get the answer.
Just finally, talking about the detective work, can you rule out the theory that the virus may have escaped from the lab in Wuhan?
Well, the thing about theories is that you have to have them as a way to set up where the reason why things might be occurring in a particular way. There will be theories about how this virus originated, including what we call a laboratory incident, and that has to be assessed. I can't rule anything out, and I know the team on the spot, as well as those they're talking to in China, they're not ruling anything out either. All options are on the table. And everything will be looked at.
Thank you so much for coming on the programme. It's been really interesting to talk this morning. Thank you.
Thank you, Sophie. Delighted to be here. Thank you.
Now, we'll be looking at some of the issues that we were discussing there in a special series of programmes this week. In COVID Crisis, Learning the Lessons, I'll be having a look back at the last year and asking whether we really have learned the lessons when it comes to tackling coronavirus. There's going to be 3 programmes on Tuesday, Wednesday and Thursday, each starting at 8 p.m, so do join me for those. We've got some great experts to talk us through it as well. Now, talking about the last year, you'll remember how in 2020 lockdown restrictions were eased at different speeds in different areas, the so-called tier system. But as more people get vaccinated, attention is starting to turn again as to how the current set of restrictions could be loosened. An analysis released today by the Labour Party says that infection rates are coming down slower in poorer areas and particularly slowly in the 20 so-called red wall constituencies that were lost by the party in 2019. Well, we can talk now to the Labour Mayor of Greater Manchester, Andy Burnham. Thank you very much for being on the programme, Mr Burnham. Now, you've said that there's a strong case to send vaccines to areas with lower life expectancy. So are you saying then that poorer people should receive the vaccine before older people in more affluent areas?
It's got to be a judgment based on health, Sophie. So what I'm saying is the life expectancy rate varies very widely across the UK. There are places where it's 10 years behind the areas where it's highest. So basically what that means is, in those areas, people in their 60s have the same level of health as people in their 70s in other areas. And it also is the case, I have to make this point as well, that those same areas where life expectancy is lowest tend to be the places where more people are out at work in those key professions, so working in essential retail in supermarkets or driving buses or driving taxis. So clearly they are at greater risk. I'm not saying this morning diverge completely from the phase set out by ages put forward by JCVI, but I am saying put greater supplies of the vaccine into those areas where life expectancy is lowest and allow greater flexibility for people to be called earlier.
You said, though, that it's a judgment, but isn't that almost a problem? The more complicated you make the system, the slower it's going to be, the more complicated it's going to be. Isn't speed everything right now, and is it not better just to keep things simple?
There's certainly an argument for that, Sophie. Keep things simple, and it does help with the rollout. And bear in mind, it's gone very well so far, and I'm not coming on this morning to criticise the government. The minister, who I think is on the programme, has done a good job, and I've said that to him. What I am saying is, in this next phase, though, I think we need to adopt a more sophisticated approach if we are going to achieve what we all want to do, which is to protect more people and save more lives. It stands to reason that people out on the front line in a supermarket or on public transport who have poorer levels of health are at greater risk than people who are at home and not particularly at risk. And in this first phase, we've seen an approach where all areas were given the same level of vaccine and everyone moved in step. I think there is a very strong case in this next phase for putting greater supplies of vaccine into those areas where life expectancy is lowest.
There's a real debate around this, isn't there? Who should be moved up the list? Should it be key workers? Should it be people with, as you say, where their life expectancy is lower? Do you support this idea then that key workers, teachers, supermarket workers, as called for by Keir Starmer and Tony Blair, should be moved up the list?
No, I'm going to stick with what the JCVI has said. So obviously they've set out categories, 9 categories based on age. And I think it is the case that the vast majority of serious illness and sadly death has occurred in those age bands. I think it accounts for 99 or certainly in the high 90s% of cases. But what I am saying though this morning is have greater flexibility within that. So particularly teachers or support staff, I would say, have a case to be brought forward, particularly if they're in those areas where the life expectancy is lowest and the case rates are higher. That's the approach that I'm calling for. I mean, there is a case just to take teachers outside of the whole programme and just vaccinate people working in schools. And there is a case for that, and I'm not saying I necessarily disagree with that. But broadly, let's have an approach here that sticks to what the JCVI have said, but focuses more on communities that have the poorest health and where people tend to be more out at work.
The vaccine rollout seems to be going really pretty well so far. Credit to the government for that. When do you think we should start thinking about easing lockdown?
It needs to be done carefully, and I think so far the date of early March for schools to return feels about right to me. What I would say, though, is let's not have a return to the tiers that we had before. We don't believe they worked, and the better approach, we think, would be a phased national release from lockdown where other sectors can return after schools when it's judged right to do so. That also means keeping in place, obviously, the national support for the sectors that will take longest to return. So we don't feel that the tiers worked. It was a divisive approach in the end and created a lot of confusion amongst the public as to the rules that they were being asked to follow. And in our region here in the northwest, where Greater Manchester was in a higher tier than the Liverpool City region, where shops open for longer and there was bars and restaurants still open. What happens in those circumstances is you give people an incentive to travel from one part of a region to another. And that, of course, can lead to spread of the virus. And I think the figures in Liverpool suggest that is exactly what happened before Christmas. So I don't see a case for a return to the tiers. I think the Prime Minister is talking about a national phased release from lockdown. Here in Greater Manchester, we would certainly support that.
You say that you don't believe the tier system worked, and from a Greater Manchester perspective, who seem to be stuck in the higher tiers for so long, I can understand that. But at the same time, you mentioned Liverpool, it does seem to work in other areas. If you look at Liverpool, they went into Tier 3 on 14th of October last year, a case rate of 468 per 100,000 people. But by the end of October, that had dropped right back down to 315. So in some areas, the tier system did work, didn't it?
People, if you look at what actually happened in that instance, people say that Liverpool was already showing a decrease before the tier system came in. I think there are examples where you can argue it both ways, possibly, Sophie. But overall, we've looked at the analysis, and certainly in Greater Manchester, the tier system at no point turned the number of cases around and brought a sharp decline, possibly dampened the number of cases, but we don't think was sufficient to stop the spread of the virus. And even in Liverpool, which was in a tier, wasn't in no tier before Christmas, the tier that it was in didn't, of course, stop the spread. And the key thing to bear in mind here is the emergence of the new strains. So we've got a bigger challenge on our hands than the one we had last year. And the tiers weren't strong enough to contain the old, milder form of the virus. They certainly won't be strong enough to contain these new, more aggressive strains that we're seeing emerge around is the right one as far as I can see. It will just be clearer, be better understood by everybody. And I think businesses will know where they stand. I think what we've got to avoid is the stop-start approach that we saw last year, where businesses are able to open, then all of a sudden they're being asked to shut again, so they just can't plan in that kind of situation. We need a kind of, a more methodical approach to this whole thing. And there's a crucial thing, Sophie, I just need to say that needs to be in this mix as well. Test and trace is now working better than it was. We've been working with the national system and it's got to a higher standard. What isn't working is support for people to self-isolate. That is the weak link in the chain. It's our Achilles heel at the moment. Dido Harding said last week that 20,000 people every day are being contacted, but then saying they can't afford to self-isolate. We cannot allow that situation when there are these aggressive new strains around. We have to put in place a simple system that covers people's wages who otherwise would not be able to have that support if they're asked to self-isolate.
Just finally, with your kind of former Health Secretary hat on. There's been reports around this weekend that the government's planning a big shake-up of the NHS, effectively rolling back the 2012 reforms, putting more power back in the hands of ministers. Do you think that's the right thing to do?
Well, it makes me smile because I don't know if you remember, but I vehemently opposed those Lansley reforms at the time and said that they would cause the problems that they have, i.e. much greater evidence of the private sector in the NHS and a weakening of ministerial accountability. So it's a decade on when actually we really shouldn't have gone down this way in the first place. But yes, I do support it. But what I wouldn't support is a complete centralisation of the NHS, going to a very top-down approach. I have no problem at all with ministers having more control, but they need to work to give more devolution to areas like Greater Manchester so that we can work on the ground to take health out of its silo and link it to housing and all of the other things that build people's health. If anything, if we've learned anything this year, Sophie, we should learn that health is built in communities, in workplaces, and there are far too many places across England where people don't have a home or a workplace that supports good health. And what we need to do going beyond this is focus on those health inequalities. And that means taking a place-based approach to looking at health, a more devolved approach.
OK, Andy Burnham, thank you very much for coming on the programme this morning. Interesting to talk. Thank you. Now, over 11 million people have received a vaccine dose in the UK so far, but concerns have been raised, including by ministers, that take-up of the vaccine is lower among certain communities, including black and other ethnic minority groups. New data released today by the Royal College of GPs and shared with this programme shows that 91% of vaccine doses so far have been given to white people. So this week, I've investigated why that might be and what it means. When vaccination is the clearest route out of the pandemic, speed matters. And the UK is a world leader, with some in government believing that all adults could be offered their first dose by the summer. But it's not the offer of a jab that matters, it's whether people actually get it. And lower uptake of the vaccine among Britain's ethnic minority community is a serious concern. People from black, Asian and minority ethnic groups are more likely to die from COVID-19 than white people, but there's also higher levels of hesitancy towards the vaccine. Birmingham Ladywood is one of the most diverse constituencies in the country. Their Labour MP, Shabana Mahmood, says she's fielding calls from worried constituents regularly.
What I've been picking up from doctors and other people on the front line in my constituency is that there is much more vaccine hesitancy amongst some of our black, Asian and other ethnic minority communities. They're picking up many more people who are saying no, that they don't want the vaccine, and they are concerned about it. So, that's been flagged with me by local GP practices in my own constituency, and I know that others in Birmingham are doing the same.
Figures from the Royal College of GPs, shared exclusively with Sophy Ridge on Sunday, shows that 91% of people who've received a vaccine are white, and only 5% come from Asian backgrounds. Just 2% are black and 1% mixed race. To put it another way, 14% of white people have received at least one dose so far, compared to just 9% of Asian people, 7% of black people, and 5% who are mixed race. White people are twice as likely to have had a vaccine than black people, and more than 3 times more likely than the mixed-race population. Barriers to healthcare access could be a factor, and some argue that a wider lack of trust is at play.
There's a general mistrust of the NHS because there's some histories, certainly in the UK as well as abroad, which have not been good. And these are validated from royal colleges. So, for instance, the Royal College of Midwives, Royal College of Obstetrics and Gynecology tell us about the very poor outcomes for black and ethnic minority people in respect to pain control during delivery and indeed stillbirths, etc. So one's got to ask, why is that? There are issues, of course, well known in the field of psychiatry, where a lot of younger black people are grossly overrepresented, and people have done the matching analysis. They are sectioned much more quickly. They are given various drug regimes much more quickly than their white counterparts. So there is this general mistrust.
Dr Michael Dawes is a junior doctor from Birmingham who's been on the front line in the fight against COVID-19 since the beginning. He's been shocked at some of the things he's heard from nurses on his own wards.
really shocked me when nurses would actually go and tell people, don't take the vaccine. But what really got me the most is when I heard one of the nurses I spoke to say, come on, you call your black nurses, Auntie, come on, Auntie, we need to go get this vaccine, da, da, da. And she's like, no, my pastor said no. And I'm like, what? And that shocked me. It got me angry. And I said to her, give me your pastor's number and let me speak to your pastor.
Don't let misinformation put you or your loved ones at risk.
MPs have been trying to encourage their constituents to get vaccinated, with a video from a cross-party group of black MPs presenting a united front.
I will be taking the vaccine.
I'll be taking the vaccine.
When it's my turn, I'll be taking the vaccine.
But outside of Westminster, community action is seen as key, and some doctors have their own strategies to get the message out.
I've been researching and asking people, what is it that we can do as healthcare professionals to help build that trust back? I think that in order for us to be effective in vaccinating the black community, we have to build back that level of trust. We've already done a vaccination program where we talked about it, where we gave people the opportunity to ask questions and we give them the answers. And if any answers that we don't have, we go and seek them out and point them in the right direction.
There's widespread support for this kind of community-based action, but there are also calls for the government to tailor their messaging more towards different communities.
The messaging, I've said, is paramount. It has to be good, it has to be consistent. It has to have transparency and, most of all, honesty. And I'm unfortunately in these categories, in quite a few situations, I think this government has come up short. What governments have to do, they have to harness members of those communities, members who are trusted, members who are well known, from the spectrum of the age groups, be it footballers, poor Marcus Rashford, but the Rashfords and the Sterlings, the Lenny Henrys, people are well-known faces. They have to get those people involved in the messaging. And also, very importantly, at the community level, you have to engage with community leaders, with the church leaders or the mosque leaders, and that's happening to some extent. That is the way you're going to do well, not by some top-down comments.
The Royal College of GPs says that if the government doesn't get a grip on vaccine take-up, particularly among communities worst hit by the virus, COVID-19 could remain a threat in some parts of the UK for much, much longer.
And if you'd like to go down to the lady waving, okay, you don't.
It may be a bit early to speak of Britain's vaccine success just yet. Well, we can talk about some of those issues with the man who's in charge of England's vaccine rollout, Nadhim Zahawi. Thank you very much for being on the programme this morning. Some pretty concerning statistics from the Royal College of GPs. White people twice as likely to have been vaccinated as black people, 3 times more likely than those who are mixed race. How concerned is the government, and why do you think there is this lower take-up in some communities?
Very concerned. So if you look at the ONS data, vaccine acceptance in the UK is incredibly high, which is very positive. 85% of adult population say they will very likely take the vaccine, but the 15% that are vaccine hesitant skew heavily towards BAME communities, and especially Afro-Caribbean and Black communities, and of course, other Asian BAME communities. So the NHS, throughout the whole deployment program, we have a standing daily equalities section that we go through and make sure we're targeting both with the national message, the regional message, and then the local message, the hyper-local message, and engaging with those faith leaders, community leaders. We've announced £23 million working with local government, because local government has a big part to play in this. And Eleanor Kelly, who is the Chief Executive of Southwark Council, has joined us as COO of the deployment campaign. And we'll be saying more on this, on how we continue to make sure that we deliver the messages in the languages that people feel comfortable with as well. We're translating all the messages into 13 languages, from Arabic to Farsi to Urdu to Polish, across the board, so that we reach those hard-to-reach communities. Because as long as we make sure we reach them, those top 4 cohorts represent 88% of mortality. And as you heard from Andy Burnham, and I'm glad he agrees on the JCVI prioritization for phase 1, the top 9 cohorts is 99% of mortality. If one particular community remains unvaccinated, then the virus will seek them out and will go through that community like wildfire. And that's not something any of us wish to see, which is why we're spending a lot of time, a lot of resource in this area. And you'll hear more on this from me in the coming days as well.
Really concerning, of course. You did say last week, though, that the government isn't keeping a record of who's refusing to take the vaccine. If you don't keep the data, how can you actually tackle the problem?
So, Sophie, we keep ethnicity data, and we're publishing ethnicity data. We also know what the population is of the top 4 cohorts, and then the population of the top 9 cohorts. That is known to us. But because this country, as Boris Johnson quite rightly said, we don't mandate vaccination. We don't make it, we don't force it down people's throats. We do it by persuasion, by sharing information, by explaining to people how good it is for them to stay safe for them personally and their family and their community. And so we know, obviously, levels of uptake, and therefore focus on those groups that we need to focus on to make sure we get the hard to reach groups, not just, of course, what we've had is a phenomenal response. 90% of over 75s have been vaccinated with the first dose. Very high levels of acceptance. That is the highest in the history of vaccination programs. Flu vaccines don't even get close to that figure. They're in the sort of high 80%, and that's fantastic. But this is an important issue. We're focusing on it, and you will see more from us on this with the NHS to make sure we deliver for all the communities that we want to protect.
There are also concerns about anti-vaccine content online. There's a report out by Sky News today showing that social media companies are one of the key ways that anti-vaxxers, if you like, raise money and get the message out. Do social media companies need to do more to protect against anti-vaccine content?
They're doing quite a bit, but we continue to work with them. So we set up a unit in the Cabinet Office, a cross-government unit.
So they're doing enough then, you think?
No, I'm about to answer your question, Sophie. We set up a unit across government that looks at all the anti-vax messages and alerts the social media platforms to them to help take them down as quickly as possible. We want them to do as much as they can, as quickly as they can, and we continue to work with them very closely. But we can always do more because there is too much. I can tell you from my own community, I look at the Middle Eastern community and sort of the conspiracy theories. They don't just use, obviously, Facebook and Twitter. They also use other platforms like WhatsApp and text messaging to get those anti-vax messages, those fake videos, fake information across. And we're working with the social media, not just on the platforms, but on the other channels that people may use to try and spread some of this fake information to prey on those who are worried and who may be hesitant, which is why we want them to get the real information from their GPs. That was a brilliant piece you've done there, because actually it's the practitioners. I've done numerous roundtables with Black and ethnic minority practitioners, nurses, doctors who've been jabbed themselves, because the best experience is from someone you trust that's already taken the vaccine.
Yeah, it does feel as if those frontline health workers are absolutely vital. I'm sorry to rush you, we've just got quite a lot to get through, but we've talked a lot about the concerns over take-up, but of course the vaccine rollout programme does seem to be going pretty well, very fast. A leaked letter from a government advisor this week said the vast majority of adults will have received a COVID jab by the end of May. So are we on track for that to happen?
Well, the limiting factor is vaccine supply. So vaccine supply remains finite. I can tell you that yesterday, between 11 and 12 o'clock, we almost got to 1,000 jabs a minute. We got to 979 jabs a minute. So the deployment infrastructure, of which GPs are absolutely the backbone of this whole deployment, with hospital hubs, national vaccination centres. Now we have 100 national vaccination centres and 200 pharmacies. The deployment infrastructure can do the volumes that we'll get through. I'm confident we'll meet our mid-February target of the top 4 cohorts. I'm also confident, because I have enough line of sight of the deliveries that are coming through, that we'll also meet the 1 to 9 cohorts by May, and we'll say more about that next week when we hit the first target, I hope. all goes well. It's a tough target, by the way. Many people who are clinically extremely vulnerable have to be reached by the GP. Some of them can't travel. We have to go to their home. We set up a drive-through in St Albans yesterday, and the emotion there was extraordinary. Sophie, people who are clinically extremely vulnerable shielding could come in their car and get that first dose was amazing.
Lots of people, of course, are going to be moving to get their second dose in the coming weeks. Given logistical challenges, given supply challenges that you mentioned, should we expect the pace to be slowing down a bit? And could that put the target of vaccinating all over 50s by the end of April at risk?
Well, it will vary, no doubt. And as I said, look, vaccine manufacture remains challenging. Any manufacturing process is challenging. I'm a chemical engineer by background, but as Patrick Vallance has said, there's never been a vaccine manufacturing process of a new vaccine without its challenges. But we see better stability now and greater volumes, but they will move around. Plus, as you quite rightly just pointed out, we are beginning obviously to store the second dose vaccine as well. So we will begin in March to do both more first dose, but of course then the second dose for both Pfizer and Oxford AstraZeneca.
Testing obviously important as well. Government's going to be offering quick COVID tests to all workplaces with over 50 employees. What's the idea? When's it going to happen?
So both are important. It used to be to employers who have 250 workers. We've reduced that to 50 because we want it to become the norm that people, when they go to work, once we are over this, obviously, lockdown, then they can be tested rapidly. We've got the volumes in place. We've done a similar thing with local government and key workers. This is a really important point, Sophie, because vaccines are our way out of this pandemic, but coupled with vaccines is test, trace and isolate in the way we're doing now in Woking. So we need to be really forensic because of these new variants to go after them very rapidly and isolate them and isolate those who are then who have the new variant to quarantine so that we can stamp out any new variants while we continue to vaccinate the nation.
Talking about the new variants, clearly a big concern for the government and everyone really. The Financial Times has reported this study of 2,000 people, which has shown the Oxford vaccine does seem to be less effective against the South African variant and has limited efficacy in protecting against mild and moderate disease. Have you seen this study and are you worried by it?
I spoke to Jonathan Van Tam this morning. Of course, the good news about the Oxford AstraZeneca vaccine, which is sort of the flip side of that headline you've just quoted, is that it does protect against severe disease.
Well, hang on a minute, sorry. At the minute, I understand that AstraZeneca believes that they're confident that it does, but that actually, because the median age of participants in this trial was 31, the fact that no one died or became seriously ill, they just don't know yet if it does.
Well, as I said, through their own trials, AstraZeneca is confident that it does effectively deal with serious illness, serious disease and hospitalization. But to your very good point, and this is a really important point for your viewers, of course the virus will mutate. And the more we vaccinate, the more virus will attempt to survive and mutate even further. We have the world's best genomic sequencing ecosystem industry in the UK. So we are able to sequence the genomes of the mutations rapidly and then talk to the manufacturers. And you saw the deal we announced this week with CureVac, where we're going to be looking to manufacture the new variant of vaccine that deals with the variant of virus in the UK, the same way as the Prime Minister visited Scotland to look at Valneva, where that vaccine is a whole inactivated virus, so has much greater effectiveness, hopefully, on the virus. And that, again, future-proofs our country so that we know we can produce new variants of vaccine ready to revaccinate or boost the protection of the nation. This is all part of the strategy that the Prime Minister quite rightly pushed us both in Bays with the vaccine task force, but also in our thinking now that we have to not only vaccinate the nation and protect them, which is what he wants us to do rapidly, but also begin to think about, okay, well, what comes next? If the virus mutates, we have to be ready with the new variant of vaccine to deal with that virus.
Mutations clearly concern, South African variant clearly concern. What I don't really understand is, the government's so worried about the South African variant that you've told people in certain postcodes that it's imperative that they stay at home. So that means that people who live in Ealing or some postcodes in Worcester, for example, are told that they can't even leave their houses. They should get a test as quickly as possible. But someone can still actually travel back from South Africa as long as they don't get a direct flight and they don't even necessarily have to quarantine in a hotel. How does that work?
Well, I'll tell you exactly. So hotel quarantine is part of the overall control of our borders. It is one part, an important part, and that's coming on the 15th of February. But actually, the really important part is the passenger locator form, which allows to know exactly where you're staying. And of course, the pre-departure testing that we've introduced. And of course, we've banned travel from 33 countries where we are worried about the mutations of the virus in those countries. So it is a combination of all those things. So if you come from any country, even now you have to quarantine for 10 days. And of course, we will make sure that that is policed well, and it already is being policed much more strictly.
You're relying on people though, aren't you? You're relying on their goodwill to do it if you don't put them up in hotels.
Well, no, the hotels is if you are a British national or a resident of this country and you're coming back from those countries of concern, the 33 countries, then we will put you in a quarantine hotel. But if you're coming to the United Kingdom for any other reason, you still have to quarantine. And the passenger locator form means the airline will not let you on if you don't have that filled in. And actually, it's an offence not to have it filled in and carries a fine with it, as well as, of course, the pre-departure test. So it is a combination of measures. Countries like Germany did the same thing in January. Canada did the same thing in January. All countries are looking at how to protect.
You're talking about the red list of countries, but the South African variant's been found in 41 countries. 29 of them aren't on the ban list, on the red list, if you like, travelling to the UK. The Brazilian variant, another variant of concern, found in 10 countries, 6 haven't been added to the red list. If you look at what SAGE warned on the 21st of January, they said that geographically targeted travel bans cannot be relied upon to stop the importation of new variants. So why aren't you imposing hotel quarantines for all travellers?
Well, because one, you already have to quarantine. It doesn't have to be in a hotel. We are saying that
But we know from Dido Harding that 20,000 people told to self-isolate, don't do it every day.
So well, at the moment, the test and trace is running at about 86% of people who are testing positive actually being contacted, 93 to 96% of their contacts being contacted, and the capacity is at 800,000 tests.
But my point is people don't always do what they're told.
And that's why there are fines associated with it. And also this rapid testing now. So one of the things that we are doing, if you look at what we've done in Worcestershire and in Woking as an example, is the ability to very rapidly put in the resource to test very small geographies. And we've learned that, by the way. We've learned because we've seen it done in other countries like Australia and elsewhere. So it's a combination of a mass vaccination program plus forensic rapid testing and 10-day quarantine with fines and with testing there and checking. You have to quarantine for 10 days and we will be checking to make sure that that is happening. It's a combination of all those things that SAGE said you have to deliver because that's how you protect the country whilst we are vaccinated.
SAGE also said that there's no point just targeting certain countries, putting them on the red list because of indirect travel, but also because of the lag between the emergence and identification of variants of concern. I mean, that's true, isn't it? I mean, you only have to look at the first wave where we were banning flights from China, but not from places like Spain or parts of Italy where lots of people had the virus, but we just didn't know it at the time. Are we not learning the lessons of the first wave here?
Well, I disagree with respect because you just heard Sir David Nabarro talk about us learning the lessons. We learned the lessons around SAGE in terms of making sure that we target very, very quickly, which is what we're doing now, which is what we're doing in Woking. Now, one of our strengths is the ability to sequence the variants rapidly in the UK, and we're offering that to the UK, which is to your question. If you're able rapidly,
Sorry, we're losing you slightly there.
Forgive me.
Hopefully you can still hear me okay, Mr. Zahawi.
Yes, I can.
Excellent. Just finally, I just want to ask you a little bit about vaccine passports. We've seen countries like Denmark and Sweden say they're looking at introducing these vaccine passports. So if you have a vaccine, you can travel into the country. Are we looking at the possibility of creating them here?
No, we're not. We have, as of yesterday, given the first dose to 11.5 million people. And what they get is a card from their NHS with their name on it. And of course, the date they've been vaccinated with the first dose and then the date for their second dose. One, we don't know the impact of the vaccines on transmission. Two, it would be discriminatory. And I think the right thing to do is to make sure that people come forward, be vaccinated because they want to, rather than it being made in some way mandatory through a passport or others. If other countries obviously require some form of proof, then you can ask your GP because your GP will hold the record. And of course, that will then be able to be used as your proof that you've had the vaccine. But we are not planning to have a passport in the UK. I just want to repeat that because I've had a lot of it on my social media. There are small startup technology companies that have had some funding from UKRI and Innovate UK who are looking at apps in this area, but we are certainly not looking to introduce it as part of the vaccine deployment programme.
Just quickly, because I know how important this is for so many of our viewers in the lockdown. We've talked a lot about how well the vaccine rollout seems to be going, but SAY just warned of a fourth wave if restrictions are eased too quickly. There are reports today that NHS providers wants to wait till infections have fallen 95% on current levels before easing restrictions. How long should we be bracing ourselves for these restrictions to keep going for?
Well, our target is obviously to have given the first dose to the top 4 most vulnerable cohorts by mid-February. So that's the 15th of February when we will look and review all the data. We've got a couple of big pieces of research, one in care homes testing every day, one with frontline healthcare workers testing every day, which will give us much better data in terms of the impact of the vaccine on infections and transmission. The Prime Minister will then come to Parliament on the 22nd of February, as he quite rightly agreed and has targeted, and then talk about how we're going to gradually, first of all, reopen schools on the 8th of March, if all goes well, and then gradually reopen the whole of our economy. But we have to be obviously mindful that we want to make it based on the evidence of the vaccine efficacy and the impact, obviously, on transmission, hospitalization, and death, ultimately. It's a race against death, Sophie, that I keep reminding anyone who's willing to listen to me, and which is why we're moving so rapidly to vaccinate and protect those most vulnerable cohorts. The 1 to 9 is 99% of death from COVID.
Thank you so much for covering the programme and so much to talk about on vaccines, so it's great to have you on. Thank you.
Thank you so much.
Now, the pandemic has squeezed Brexit from the headlines over the last year. Who'd have thought that 12 months ago? But the end of the transition period and the Brexit deal that was agreed just a few weeks ago are having a dramatic effect in one part of the UK, in particular, Northern Ireland, with checks on goods travelling from Great Britain causing severe disruption and in some cases even shortages in shops. Tensions, of course, have ramped up further after the EU threatened last week to use a clause in the Brexit deal to impose a border between Ireland and Northern Ireland to block vaccine exports. Well, let's talk about more on that. We're joined from Dublin by the leader of Sinn Fein, Mary Lou McDonald. Thank you very much for being with us. There's growing concern about these checks between Great Britain and Northern Ireland. How bad is the situation?
Well, a very good morning to you, Sophie. And as you say, Brexit had dominated very much the political conversation, not just across Britain and Ireland, but of course across the continent and the globe. And the reality is that the deal, the final withdrawal deal, was only struck very, very much at the 11th hour. There are specific protections for Ireland. They are absolutely necessary to protect our all-Ireland economy, to protect our political infrastructure, our peace process, and so on. And it is fair to say that 6 weeks on, that there are some teething problems and difficulties with the application of that protocol. So really what needs to happen is a sensible, informed conversation between the British government on the one hand, the European Commission and institutions on the other. And the flexibilities and mechanisms envisaged in the protocol need to be used to iron out and mitigate those initial problems. But it also has to be said, Sophie, that Brexit was never a good idea. We argued strongly against it. We advised very strongly that there would be disruption, that there would be difficulties, and really it should not come as any surprise to any sensible person that we are now facing into some level of disruption and difficulty. The protocol flexibility will deal with a lot of those concerns, but no one should pretend, least of all the Brexiteers who shouted most loudly for Brexit and told us that Brexit is Brexit. They should not be surprised at the fact that Brexit is disruptive. Brexit is bad news for Ireland. And of course, it creates these kind of trading difficulties. I also noticed...
We do know, of course, your position on Brexit very strong, but at the same time, now that Brexit has happened, just to kind of look at what can be done to try and mitigate the issue as at the border and with the movement of goods. Do you think the grace period should be extended, as some has called for, to the grace period for checks on goods?
Well, Mr. Šefčovič from the European Commission will be in London during the week. He will meet with Mr. Gove. And I think, firstly, there needs to be a very detailed examination of exactly where the bottlenecks are. And I think there needs to be an assessment of the flexibilities that we have and how they have been applied or not. So that's the first job of work. And then beyond that, there needs to be a consideration of what we can do whilst respecting the fact that the protocol is now in play. It is a matter of international law. It is absolutely necessary to protect just the baseline issues for the island of Ireland. But I think all of these things, Sophie, are surmountable once we have calm and once we have a sensible conversation. And I've said, I think, to yourself, Sophie, amongst others, many, many times, I mean, the truth is that Britain or England in particular has decided to Brexit, and who are we to stop that, although we regard it as ill-advised, but that's just a view. We respect the democratic wishes of your people, but equally there has to be a respect that a Brexit that was not sanctioned democratically by the people of the north of Ireland cannot wreck the Irish economy and the stability that has been painstakingly constructed by all of us over decades now.
Talking about that stability that's been painstakingly constructed by people, the EU hasn't exactly helped matters either, has it? They threatened to trigger Article 16 to stop vaccine exports to Northern Ireland. That would effectively have created a hard border. I know that they rolled back, but they haven't exactly led to the calm and sensible conversations that you've been talking about.
Yeah, I mean, I agree, and everybody agrees that the talk some days ago about any prospect of triggering Article 16 was absolutely ill-judged. And fortunately, the European institutions stepped back from that very quickly when they gauged the reaction of everyone, including all of us on the island of Ireland. So that didn't happen, nor should it. And so, therefore, I think any talk from any quarter of some kind of retaliatory tit-for-tat approach by the British government, I think is just very, very reckless. I think good sense, common sense, and a real understanding that Brexit is for keeps. I mean, this is a big game changer for all of us, and it has to be managed in a way that is sensible, in a way that is fair. None of us wanted trading barriers between our island and the island of Britain or across the continent, but Brexit has happened, and in some respects, those that advocated this so strongly now need to very much accept the fact that these are the consequences of their decisions. And for us on the island of Ireland, there is the immediate need to have the protocol work to protect Irish jobs and livelihoods, to secure the infrastructure of our peace process, but also looking ahead, Sophie, we face into a very interesting and a very challenging time ahead for all of our people, because the constitutional question on the island of Ireland is now live. the issue of partition and the border on our island almost a century on. And that's something that the British and Irish political system need to step our way through very carefully, because we need to create the ground and the plan now for an orderly, peaceful, democratic, constitutional change and Irish unification.
Okay. Just finally, the UK's ordered around 400 million doses of vaccines against COVID-19. Given the, shall we say, quite slow pace of the EU's own vaccine rollout, would you like to see any excess doses coming to Ireland?
Yes, I would like to see, not just between Ireland and Britain, but globally, a real sense of generosity and solidarity when it comes to vaccination, because we need to ensure that there is not a reservoir of this virus anywhere. I mean, we live in a global community, so any notion of kind of a narrow nationalist view of...
Specifically, though, would you like to see vaccines from the UK going to Ireland?
Well, certainly if there is an excess of supply in Britain, and if there is a capacity for that to be shared with Ireland at some point, well, yes, of course, absolutely. The project here is to get people vaccinated. And this is, as I heard your previous contributor remark, this is a race against this virus and against death. So yes, I think a spirit of fairness and generosity needs to prevail in this, my goodness, above all other issues. So yes is the answer. And if the scenario, by the way, Sophie, were vice versa, I would expect that a similar generosity would be afforded to the British people, because the virus doesn't care about politics or borders or any of these things, and we all share the same human biology. And it is so important that the incredible work that has been done by scientists internationally, including at Oxford University and across the globe, that the fruits of that endeavour and knowledge and expertise is shared in the way that good science would intend. And that means keeping all of our fellow human citizens safe and alive and well.
OK, thank you very much for being on the programme this morning. Thank you. Well, that's it for this week. Don't forget, you can check out the Sophy Ridge on Sunday podcast, available from lunchtime. The best bits of our interviews will be on there, plus some analysis from me and my producer, Matt Lavender.